Okay, in this video I'm going to talk about muscles particularly of the cervical region. And before I get started on that, I want to make a few comments about muscle activity in the spine in general. And one is that one unique aspect of the spine is that we talk about a unilateral action and a bilateral action for all muscles. So in terms of the extremities, you can always talk about a muscle acting unilaterally or bilaterally, right? One side or both sides working. That doesn't really change the actual muscle, how the muscle works though. The spine, muscles of the spine are unique in that because they actually meet at the spine, they're going to have a certain action when they act bilaterally and a certain action when they act unilaterally, okay, because they have that capacity to link together. So generally speaking, any muscle of the spine which is on the posterior side, when it acts bilaterally, so both sides are going to extend. When it acts unilaterally, it may rotate or laterally flex. Now, its ability to rotate or laterally flex is going to depend on where it is in terms of the axis of rotation, which is the spine itself, and in terms of its fiber direction. But if it does have in general, it's going to be able to do typically one of those two. And then conversely on the anterior side, if it's on the anterior side, acting bilaterally, it's going to flex the spine. Unilaterally, it may be able to laterally flex or rotate, again, depending where it is in relation to the axis of rotation, which is the spine, and its fiber direction. Another important thing to realize is that both in the cervical region and in the lower spine regions, some muscles can rotate to the same side, and some muscles can rotate to the opposite side. And this is a concept I know that students have a hard time with. So let me back up and talk about lateral flexion first. So for a muscle to laterally flex, no matter where it is in the spine, it's got to be far enough away from the axis to have kind of a lateral pull. Okay, so it just has to be able to pull, for example, with the head. So if I have them up like this, it's going to have some kind of pull on the side to come this way. And obviously if it's really close to the spine, it's not going to have a lateral pull, it's just going to extend. But if it's anywhere over here, it can laterally pull the head to the same side. Lateral flexion, if a muscle can laterally flex, it will always be to the same side. It's not possible to do it to the other side because a muscle can only pull, it can only push. So any muscle that laterally flexes will always be the same side. Rotation is a little bit different. Okay, some of the muscles, if they have the capacity to rotate, will rotate to the same side, and some will rotate to the opposite side. And that's really a question partially in terms of where the muscle is and the size of it, but it's mainly dependent on fiber, the direction of the fibers. And that's just something that you're going to have to look at individually at the muscles. There's really no hard and fast rule, but it just depends on the fiber direction. So it's really important that you get this concept that some of the muscles rotate to the same side and some of them rotate to the opposite side. Regardless, they will always laterally flex to the same side. So if you have a muscle that you want to stretch that rotates to the opposite side and laterally flexes to the same side, how do you stretch those two components? To stretch the lateral flexion component, you're going to laterally flex to the opposite side, right? Whenever you stretch a muscle, you do the opposite of what it does when it contracts. But to stretch that rotary component, you have to rotate to the same side, okay? So I'm not saying you would always do that in one stretch because it can be a little bit awkward, but in theory, if you want to fully stretch a muscle that laterally flexes to one side and rotates to the opposite side, to stretch it, you're going to laterally flex to the opposite side and rotate to the same side. Okay, I know that's confusing for people. You need to get it in your head because it's really important to get that concept straight. And I know that students have a hard time with that. And again, you may not do that in one stretch, but that's something that you need to keep in mind. So just to briefly review muscles we've already talked about, for example, Levator Scapula and trapezius. Levator Scapula comes from the transverse process of the cervical vertebrae 1 through 4 and inserts kind of to the medial part of the scapula. And unfortunately, I can't really demonstrate the neck very well, but it's going to rotate. When it shortens, it's going to pull the neck and the head as a result to the same side. And note that for muscles in the cervical region, they may be actually rotating at the head if they have an attachment to the head, or they may be rotating at the cervical spine if they've got attachment on the spine. It just depends. So Levator Scap is going to pull to the same side, but the trapezius muscle is a bit different. So the trapezius muscle is going to come from part of its origin, right, is from the occipital protuberance. So I'm just going to put it here just to keep it simple. And then it's going to insert over here, right, to the spine and the acromiolateral third of the clavicle. So when I pull on this string, which is kind of like the muscle shortening, right, because it's going to pull this way, right? So technically this is pulling the origin towards the insertion. Which way is the head going to go? Okay, this is my right trapezius. It's pulling the head to the left. Okay? So, I mean, it's just something that you've got to kind of figure out and work on. So, levator scapula is same side, trapezius is the opposite side. Another muscle is the Sternocleidomastoid, or the SCM. The SCM has two heads. It's got one from the sternal head from the top of the manubrium, and it's got another head from the lateral third of the clavicle, and it inserts onto the mastoid process in the lateral portion of the superior nuchal line. It's going to come up in here. Okay, so notice this is my right SCM, and when I pull on this to shorten, it's going to go to the left. Okay, so this is the right SCM, and it really doesn't matter whether it's coming from the clavicular head or from the sternal head. It's going to rotate the head to the opposite side. So if you have the capacity to use the models with this, that's what I recommend. And while I'm a big proponent of trying to figure out muscles on yourself and kind of feeling it for yourself, I have to say it's my experience that the head and the neck muscles, if you try to feel it on yourself, are extremely confusing. It gets very, very confusing. So I really recommend that you try to play with the models, because it's going to work much better, I think. So that's the sternocleidomastoid. And the nerve for the sternocleidomastoid is the spinal accessory nerve. And it also gets some of the cervical plexus. The nerve for the trapezius is spinal accessory and the cervical plexus, and the nerve for levator scap is the dorsal scapular nerve. The scalenes are a set of three muscles. There's the anterior, the middle, and the posterior. The anterior comes from the anterior tubercles of the third through sixth vertebrae, and then insert onto the first rib. The middle scalene goes from the second through seventh anterior tubercles of the cervical vertebrae, also inserts onto the first rib, and the posterior scalene inserts onto the posterior tubercles of the fifth and the sixth cervical vertebrae, inserts onto the second rib. The innervation for the scalenes is the cervical and brachial plexus for anterior and middle, and it's the brachial plexus for the posterior. The scalenes are going to, when they act unilaterally, or when they act bilaterally, are going to help kind of elevate the rib cage. The anterior scalenes, just the anterior scalenes, when they act together, they're going to be able to flex. They're going to be able to kind of flex the neck. I can't really demonstrate it very well because this neck is not movable. And when all the scalenes act unilaterally, they can laterally flex to the same side, and they can rotate to the opposite side. So scalenes, trapezius, and sternocleidomastoid all rotate to the opposite side, but they laterally flex to the same side. The sub-occipital muscles are a set of four muscles. So sub is below, occiput is this bone kind of at the bottom of your head, and that's where they all are. They're four very small, very short muscles that all attach either to the atlas or the axis. And the things to remember with them is that they're all going to rock the head back into extension. Some of them can rotate and some of them can laterally flex. And whether they do rotation or lateral flexion or neither really depends on what joint they cross, right? Because remember we said that the atlanto-occipital joint has a little bit of lateral flexion but no rotation, and we said the atlanto-axial joint has got no lateral flexion but a lot of rotation. So there's the rectus capitis posterior major, the rectus capitis posterior minor, the obliquus capitis superior, and the oblique capitis inferior. So the rectus capitis posterior major is going to come from the spinous process, of the axis, and is going to insert onto the superior nuchal line, kind of over here. So it's going to rotate to the same side as well as rock the head back into extension. The rectus capitis posterior minor is going to come from the posterior tubercle of the atlas and also insert onto the superior nuchal line. And it's only going to do extension because it only covers that Atlanto-occipital joint. The obliquus capitis superior is going to come from the transverse process of the atlas, and it's going to insert kind of between the nuchal lines over here. It can rock the head back into extension, and it can laterally flex. So remember, it crosses the Atlanto-occipital joint. It can laterally flex, as well as rock the head back into extension. And the oblique capitis inferior comes from the spinous process of the axis to the transverse process of the atlas. So it covers that atlanto-axial joint. So it's in a perfect position to rotate, right, to kind of pull on this transverse process. So aside from extension, it's also going to rotate. It's also going to rotate to the same side at that atlanto-axial joint. And the nerve for the suboccipitals is basically just the suboccipital nerve. It's off of like C1 and C2. And those are some of the muscles of the cervical region.